Hello, everyone. I want to thank you all for coming to our presentation today, which is focused on NaviCare SoinsNavi. And this is a patient navigation program in New Brunswick for children and youth with complex care needs and their families, as well as the care team.
Oh, we can't hear you, Shelley. Oh, there you go.
Okay, thanks. I think I was muted somehow. All right. First, I'll do some introductions. So I'll first introduce myself. So I'm Shelley Doucet. My background's in nursing, and I'm based at the University of New Brunswick in St. John. And my role there is I'm primarily a researcher. I hold a research chair, which is the Jaroslawski Chair in Interprofessional Patient-Centered Care. And so I also direct the Center for Research and Integrated Care and work very closely with Allison Luke, who's here with us today. So Allison, I'll turn it over to you to introduce yourself as well.
Hi there. My name's Allison Luke. I'm a research associate housed in the Nursing and Health Sciences Department. And I work in the Center for Research Integrated Care with Shelley. And my background actually is in sociology. So I'll just leave it at that.
Great. So the program we're talking about today, Alice and I actually co-direct the program with another colleague of ours here in New Brunswick. And so in our presentation today, we're going to talk to you about how we have developed and implemented the program here in New Brunswick. We're also going to talk about the evaluation and the impact of the program. We'll share some of our lessons learned, and then we'll also talk a little bit about the opportunities for spreading and scaling the program in other areas. So right now, though, we first want to get a sense of who's on the call with us. So if we could we're going to do a quick poll. So if you could just take a quick minute to respond to the poll. That's great. And Allison, let me know too if you see anything in the chat. When I'm in this presentation mode, I can't actually see the chat coming up. So let me know if anything comes up. Now, Logan, are we able to see the breakdown? All right. Okay, so a bit of a mix. Great. Okay, so I'm going to just clear this out. Good. All right. And another thing too, if anybody wants to stop us at any time, just if you have a question that you want addressed anytime, we're happy to address it throughout or hold them to the end as well. So one of us will each be monitoring the chat at all times. So just to start out, for the development of this navigation center, it began back in 2015 when we first identified the need. And so this involved a province-wide needs assessment that we conducted, and we did interviews with over 120 individuals. So that we included youth, their caregivers, oftentimes it was their parents. We also interviewed health and social and educational care providers as well. And through that needs assessment, we identified that one of the major gaps in care for children with complex care needs was they experienced many gaps in terms of navigating the healthcare system in New Brunswick, which we know from our ongoing research is not a unique situation across Canada. So we also did other background work as well. We conducted environmental scans, which involved exploring different, once we decided we were going to develop a patient navigation program, we did a scan looking at other pediatric patient navigation programs across Canada, just to see what was out there so that we could learn from what others have done and learn about the characteristics of the programs and how they were implemented. We also did an environmental scan within New Brunswick as well, so that we could learn about all of the programs and services that were available, because once we set up the program, we wanted to have a good understanding of what was currently available so that the navigator could help navigate their clients too. And then we did site visits as well as part of that early work. So we did site visits to various patient navigation programs, including some in Ontario, in Ottawa, as well as in the United States as well. And we also secured funding at this time. So we were fortunate to receive around $800,000 in total from a local nonprofit organization in New Brunswick. It's called the New Brunswick Children's Foundation. They provided the funding to operate the center and also to support the ongoing research. And at this time too, around the development, we also developed the procedures and policies around the ongoing operations of the center. And this not only included the clinical operations, but also the research policies as well and procedures. So this is a research-based patient navigation center. And by that, we mean that you actually have to consent to participating as a research participant in order to access the services. And so that meant we had to develop research ethics applications, consent forms, and other ethical procedures just to make sure that we were following the ethical guidelines. And again, too, as I was saying, we had clinical procedures as well in order for the patient navigator to help support the families. Then we did some hiring and training. So the hiring, this involved hiring a program coordinator. We also hired a patient navigator, and we also hired research staff as well. So research assistants and a postdoctoral fellow as well. And so the training with our patient navigator received motivational interviewing training, and our navigator her background is in nursing as well. So she had the training of being a registered nurse as well. And as far on the research side, our research staff had additional training at that time around program evaluation, so that we could have additional training around process evaluation and outcome evaluations. And this led to the implementation of the center. So the center was implemented in January of 2017. And it was implemented, it's a province-wide center. So we initially implemented it. Once we went live, it was available province-wide, but we primarily did a sort of a soft launch, more so in the region, the southern region of the province, just to get things off the ground. And then, so we are now operating province-wide, which we have been for over 4 years. And then shortly after, as part of that as well, we were also developing the evaluation plan. So one of the things we did very early on was developing a logic model. And we've published that as well. And that's something we can share at the end of the presentation. And so that has really informed the ongoing evaluation of our center as well. And finally, marketing. It's not, as researchers, I wouldn't say it's our real strength. We've had to rely on different folks to help us on the marketing side. And it's definitely an area that I'm sure we could do better in, but we've developed a number of different marketing materials for the program and done a lot of outreach. So by outreach, our patient navigator will connect with various nonprofit organizations in our province to help connect and share with them about the Patient Navigation Center, and also doing visits with different clinicians, whether it be specialists, pediatricians, or primary care providers, so family physicians and nurse practitioners. So just trying to get the word out that this is a service that's available. We also have bilingual social media pages. So for example, Facebook and Twitter, various print materials. We have a bilingual website. And we also have a video. And so before we go into the details of the program, we thought it'd be a great opportunity to share with you the video here. It's a video that shows a snapshot of the program. And then after we're done watching the video, we'll go into a deeper dive about the program. So I'm going to turn it on to the video now, and just Allison, flag me if it's not working.
Shoulders, knees, and toes. Wow. My name is Hannah, and I'm the mother of Jack. This is Jackson, and he's 2. I heard about NaviCare through Jackson's pediatrician. Yes. Yes.
NaviCare SoinsNavi is a navigation center for children with complex needs in New Brunswick. This can include children who have any condition, whether it's a behavioral, physical, mental condition. So this could include autism, diabetes, severe depression. So we support all of these children. The center provides a free personalized service that can be used by both families, either youth or family members, but also the care team as well. The center is co-directed by myself and Dr. Rima Azar from Mount Allison University. So we started as 2, and we are now a team of over 20 researchers, clinicians, several students. And we also have a family advisory council who are family members from across the province who have a child with a complex health condition, who really oversee our center and make sure that we are meeting the needs of families within our community.
I joined NaviCare, their family advisory community, about a year ago, because I wanted to share my expertise of the last 25 years of going through the healthcare system and the education system and and all the challenges and problems that a parent can encounter. So I joined that to try and share my knowledge and expertise to help other families.
We have two patient navigators. One is a registered nurse and the other is a lay patient navigator who are there to help families, so children and youth, and also the care team find access to resources and services for children with complex needs. And these services and resources might be within their own home community, they may be across New Brunswick and even outside the province as well.
When a parent or family or care provider call, the first thing I do is I usually listen to their story. And they can call with needs, or it's something that we may tease out during the conversation.
So NaviCare has been a great support for our family. They've helped us find different programs that are offered for Jackson, and they've helped us kind of navigate the complex world of special needs. Yes. And right now they're actually helping me find some funding to help send Jackson to the States for 3 weeks to a special therapy program down there.
They're looking for services or resources, or it could be something specific like respite care. They may be looking for help navigating the health, education, or social services. As well, they may need help coordinating the care with their care providers.
As a parent, your focus is on your child and his or her care, and having to deal with all the logistics and the complexities is one more thing you just have to deal with.
What I strive to do really is to empower the families so that they may acquire the tools to navigate their child's journey.
NaviCare SoinsNavi is also a teaching center. So we have several students that have opportunities to have mentorship within the center. For example, we have research students at the undergraduate, graduate, and even postdoctoral level. But we also have internships as well for health professional students, such as medical students and nursing students who work with our patient navigators and have opportunities to shadow them. We're all very passionate about improving the integration of healthcare services for children and families within our province. And this is just an opportunity for us to use our skill set and our expertise to be able to make it a little bit easier for the families and the care team to be able to navigate this complicated maze of services in our province.
So if you're a parent with someone with complex needs, then the first place I would call is NaviCare and they can help you sort through a lot of the noise and point you in the right direction as you go through your journey.
I think New Brunswick is very lucky to have a program like NaviCare for children with special needs. So thank you, NaviCare.
All right, great. In my introduction, I should have shared that I also have a dog who has severe anxiety and you could hear her barking in the background, so I apologize for that. All right, so now we're going to talk about the program, so NaviCare SoinsNavi. So we just introduced it here, but now we're going to talk a little bit more specifically about the program and the services that we offer. So the overall goal of NaviCare is really to improve make it so the care is more coordinated and convenient to support not just the physical needs, but also mental health needs, emotional, behavioral, social, cultural, any type of need that these children and youth have. The idea is the goal is for the patient navigator to help support them in whatever their needs are. And this is a bilingual, so French and English, research-based virtual center. So services are offered virtually. And they're free of charge as well. So they're available Monday to Friday. And again, as I said, it's mostly virtual. There is the odd time where a patient navigator will meet with a team face-to-face, but in recent years, especially with COVID, it's mostly all done virtually. And so our patient navigator is also, as I said before, too, a registered nurse. And her role is to connect families with services and resources across sectors. And these services and resources, they may be within their home local community. They could be somewhere else across the province. And sometimes too, they might even be outside the province. So there may be services across the border in the US, or there might be services in our bordering province of Nova Scotia where we don't have a pediatric hospital. A lot of our most complex patients go to the IWK in Nova Scotia. So our navigator will help support them with connecting them with any of these types of services. The navigator also helps coordinate patient care, so works together with other members of the care team to help make care more collaborative and coordinated, so that trying to work toward having just one plan of care rather than multiple plans of care. Our navigator also helps facilitate transitions in care. For example, when youth are transitioning from pediatric to adult services, our navigator will help them navigate that transition, and also acts as a resource for the care team. So one of the unique things about this program is it's not just for the youth and the children, and their caregivers, but also as a resource for the care team. And that came from our needs assessment, when we learned that not only did the children and youth and their families find it very challenging to access our healthcare system, but the care team also found that even though they had expertise, they also found it difficult to know what programs and services were currently available, because they're constantly changing, especially government funded programs. So the idea for the center is to really act as a resource for anyone. We don't turn anyone away. We also don't turn children or youth away based on their level of complexity. So there's if they feel that they have complex needs that need to be addressed, we do accept them into the program. And there's also no need for referral or a diagnosis. In fact, a lot of clients come to us without a diagnosis, and that's the support that they need, is to help navigate actually getting a diagnosis. So the center is advised by a patient and family advisory council, and this includes 7 volunteers. And these volunteers they're mostly parents of children or youth with complex care needs, but we also have volunteer who as a child experienced complex care needs, and they're now young adult. And so the Family Advisory Council, they meet monthly, and they advise the research team, they help advise the patient navigator, and as well as the staff. And they also develop resources and help organize workshops as well. So they've developed a resource in the past. It's a journey map that they've helped to share with other families. It's used as a tool to help people see the journey through their healthcare experiences. And they hosted, just an example too, last year, they hosted a one-day workshop that was targeted at other caregivers who had children with complex care needs. And so the event brought together a number of different nonprofit organizations and care providers and caregivers to help, particularly other caregivers, to help them navigate the system. In terms of the process of working with the patient navigator, so the process, of course, starts with an assessment, and this begins during the first interaction. So it's at this time, the navigator will assess the client's needs and collect demographic information. So once these unmet needs are identified with the support of the navigator, this is when they start to develop some goals. And so all of the work that the navigator does is based around this needs assessment and the goals that are mutually identified. And it's a very personalized and family-centered approach. Every client interaction is very individualized. And then the intervention, which again, as I said, it's very individualized, it's personalized and family-centered support based on the goals. And so this takes place during the course of the client-navigator relationship. And then the next stage is follow-up. So the patient navigator maintains communication. It varies depending on the client needs, but maintains ongoing communication with the client for support and follows up as needed. And oftentimes we find during this follow-up period, that's when new needs get identified. And then the navigator needs to go back to the beginning again and do another assessment, and perhaps even do more navigational interventions as well. So it's a cycle that often repeats itself. It's not, they can come with multiple needs at the beginning and the navigator works through those. They might start with one need and so on. So then that leads to, once all of the needs have been met, that leads to the resolution. So the cases are closed, but so they're not closed, but they're archived, and they can be reopened at any time. So they can call back if any new needs arise, or if they need any additional support from the navigator. So I'm going to turn it over to Allison, and she's just going to talk a little bit about examples of how NaviCare or SoinsNavi can help.
Thanks, Shelley. Essentially, just to give an overview of what our patient navigator would see or could see, there really is quite a range. And I think Shelley's alluded to this fact, but this can really vary from very, very simple, more what we would call a straightforward case. And I'm speaking primarily about caregivers who call the center as clients. And these sorts of cases would be, there's maybe one main goal identified. So a good example would be a young family, they're moving maybe from Ontario to New Brunswick, and their child has a diagnosis of something, maybe autism spectrum disorder, and they're really just looking ahead and wondering about the services or resources that are available in the community where they're moving to. And they're quite happy to just get provided a list of things that they would work with the navigator. So maybe they say, we're looking for a music class, or are there any physiotherapists who work with children with these particular needs? And the navigator can help to sort of pull something together that's tailored for them. And these caregivers often just say, yep, just give me the list and I'll call back if I need any more support. So that would be sort of our most, I guess, straightforward of the cases. But a number of our cases there's a whole continuum in terms of varying complexity, but they can also be very, very complex, where we've had families who are with our patient navigator for over a year. And this would very much be reflected in what Shelley was talking about, where there may only be 1, 2, maybe 3 goals or needs identified early on when they meet with the patient navigator. But once needs are met, new needs come up. And it can carry on and on and on. And some of the more sort of trickier things that people might need support with would not just be simply identifying a resource, but they might require more support in actually accessing that resource. So different programming. A number of our families, and I'm sure I know we have some patient partners and parents of children with complex care needs in our group today. You folks are the experts, and a number of people call and say, I know what the resources are, but I need you to help me find funding so we can put my child in a summer camp, or can you actually help me? I know there's supposedly respite around here, but I'm having a hard time knowing how to find someone I can trust when they come into my home. So the navigator can actually work more closely with people to work with them so that their goals are met. And so it really is that individualized piece that Shelley mentioned is really key. So this could, like I said, this could be funding. It could be really much finding and helping them get access to different programs. It can be helping with filling out forms. And it can even be working in the care coordination piece and sitting down, well, virtually or in person with, say, folks who work at the school with a child to help sort of ensure that everyone's on the same page. Or Shelley also mentioned we have a number of families who call and their child doesn't have a diagnosis, and then patient navigator can actually go through what can be a difficult task of trying to get them in to see a specialist and help them get the services they need. Just very quickly, finally, when we do, and this is, I think, really important, offer services to care providers, again, as mentioned by Shelley. And typically when care providers call, it's not so much on behalf, they may have a specific family they're calling on behalf of. Sometimes it may be that they've seen a need across a number of families they're supporting. So they'll call the patient navigator looking for referrals to services and to see if there's any other resources they maybe don't know about that could help to support these families. All right, I'll let you go back. Shelley, hand it back over to you.
Great. Okay, so what we've talked about so far, it's a lot of what our patient navigator who's a registered nurse, a lot of that's more that one-on-one support from a professional. But one of the things we've learned through our research is that caregivers oftentimes want support from others who are also going through the same journey. And we also, as Allison said too, around how some of the caregivers call and they know the system and the services, especially when it's a rare condition, or especially if they've lived with the condition their child's lived with the condition for a long time, they know the system better than anyone. They are the experts. And so what we wanted to do was to explore implementing a peer-to-peer support group online, so that, and not so much an emotional support group, because those support groups exist, but what we noticed was that there's a gap in opportunities for family members and caregivers of children, youth with complex care needs to support one another on informational needs. So for example, we are a province-wide navigation center. So we envision that if we could have this support group, we could have others with lived experience posting questions, or as part of the support group, helping others in different regions of the province that they may know about unique or niche programs in these various areas. And so we thought it would be a great way to help more people than we could in a one-on-one format. And also we know through our research too, that some people they just prefer to have that support from a peer. And so we implemented this program, or this support group in January, and picked up traction right away. We have over 100 members in the group right now. It's a very active group. This project's actually led by one of our PhD students who developed the support group and is currently evaluating it as well. And so the group, they work really hard. So our patient navigator helps to moderate the discussions too. You know, she'll jump in from time to time when people have questions that maybe nobody else in the group is able to answer. She'll help provide that navigational support. But we really try to make sure that we're sort of more on the outside and let the interactions unfold through the peers. But some of the activities too, to try and encourage developing rapport. There's different on Mondays. It's called Mini Me Monday, and group members will share a picture of their child on Monday or anything fun that they did over the weekend. And then on Wednesdays, it's called What's Up Wednesdays. And then members of the group will talk about anything good or bad that's going on, or anything that they need some help with. So it's just a way to keep activity going. And it's been really effective. Once we started doing some of these different posts, it's really increased the engagement in the group, and we're seeing lots of activity. So this is just one example of how our navigation, we've been expanding it as we go. And I should say too, we've really used this as a living lab model. And by that, I mean, as the Navigation Center has been evolving since the inception of the program in 2017, we've been modifying the program as we go based on what we've been learning through our research. And one example of that too is around when we first started the program back in 2017, we only served children up to the age of 19, but we also learned through our research is that there's a lot of youth and young adults who are transitioning who need support. So that's why our program serves youth or young adults up to the age of 25, is to help them with those transitions. So this is, again, just another example of how we're continually modifying our program as things evolve. And just another resource. So again, we're trying to figure out ways to help people at the mass, like at a much more of a system level. And so what we're also doing is we're hosting these online webinars. They're each month, and they're an hour long. And every month we have a different service or organization present the services that they offer. And so the idea for this is to help people across New Brunswick learn about some of these services and resources, because this is just a way to help other programs market the services they offer. Because one of the things we've definitely learned through our patient navigation work is that people just don't even know that these great programs exist. And so we're using this as an opportunity to help spotlight programs and to connect people who need these services with these various programs through these webinars. And they've been well attended as well. It's been a great way to share and to spread all of the different resources and programs that are happening. And it's been a great marketing tool as well, because these programs will share it and NaviCare is connected with that. So it's another way to bring more clients in that we can help support them in their journey. So now we're going to turn it over to our evaluation. So Allison, back to you.
Thank you. I'm just going to cover a few high-level things on this slide, just to let you know what the evaluation has consisted of primarily. Shelley mentioned early on that we started out with a logic model, which we thought was really, really important in terms of trying to map out all the different components and how the program, how we saw it unfolding, what activities were required, and then looking at all the different outputs, as well as then moving into more of the outcome pieces, the impact piece, which I'll address a little later in terms of how challenging that can be. But the logic model this has been published, so it might be an interesting read for some, but it was quite complicated because we are a unique service in that it's through a university, it's a research-based program, but we are providing a service to the public. So we have this research component as well as the key piece around delivering patient navigation, but we're also very, being part of a university and it's important to us that we have lots of trainees and students and grad students and that they get opportunities to do other studies. So it makes for really quite an amazing living lab piece. So one of the things we have done to date is publish the logic model, and we're in the process of doing a process evaluation to sort of look at the program integrity to see if what we've wound up with has maintained the original vision. We've also been doing a lot of client evaluation type stuff, focusing mostly on experiences as well as satisfaction. Shelley mentioned the Facebook page, and I know I had the chat up just because I saw some stuff popping up in the chat while Shelley was talking, and a lot of stuff around interest on our Facebook group. And I can just say one person asked if it was monitored or allowed to happen organically, and a lot of this is going to come out in the findings that our PhD student is actually in the process of pulling together and writing up. So she's been actually looking, one of the things she's looked at is how to maintain members of the group and how are the posts unfolding and what sorts of posts lead to more interaction to sort of try and look at that organic piece. And I can say that initially the goal was that it would become something organic, but it was started fresh because it was a PhD project. It needed a little more moderator input at the beginning to kind of kickstart it. And what we found is over the last few months, it's really started to just grow as a cohesive group. So I can say that this is being evaluated. There's been a survey component as well as an interview component. And she's also analyzing and looking at all the posts, and of course consent was achieved before she did all this, and everybody signing up knew that it was part of a research project, and we'll be happy to share those findings when we get those. We've also had, I mentioned a little bit about this, some challenges with measuring impact, and this kind of harkens back to the keynote earlier today, just in terms of how do you measure programs that focus on integration. And I think what's challenging about patient navigation is we're kind of the middle person in the whole process, because we don't actually deliver the care. We try and get families and children and youth into resources, services, programs that will meet their needs. So that can pose some challenges when it comes to evaluating our impact, but we have been trying to address that. And I should just point out that another piece of the evaluation is that our patient navigator is all the time taking note of barriers and gaps as they arise when she is meeting with clients, whether caregivers or care providers. And we compile these every so many months and package them up into like a policy brief that we then present to government, because we think that's an important part of what we do. So I'll just get you to go to the next slide, Shelley. So I'm just going to talk very quickly about the process evaluation and to start this off, because I know this was in the chat. Just to say that we have one patient navigator. So Shelley, in the video, it says 2. In early days, we went with 2. We had more funding. It was a lay navigator and a registered nurse. We now have 1 registered nurse. So we do have 1. And we don't have a wait list, because I know that was a question. So far, knock on wood, we have not had that problem. And I think this will come out a little more in the process evaluation. One of our issues, because we're university-based, we're research-based, we're not embedded in a clinic or a pediatric practice or in the hospital, it's very challenging to market something and to get people to come to us. So one of the big things that came out from our process evaluation, where all the staff, the patient navigator, the co-directors were all interviewed, but as well, the person who ran it actually did a scan of some of the client interviews. The big thing that came out was we need to focus more on outreach, marketing, getting the word out, so that people know that this valuable resource is there. In terms of who's calling and using the center, because I think this was in the chat as well, and I have some numbers around here, we know that it's mostly caregivers who have been calling, generally mothers. We've had about 20% though of our calls come from care providers, and most of those care providers would come from the social services sector. Okay, we have had a couple of pediatricians, primary care doctors as well, but it's mostly social workers. The average length of time that a family, so this would be caregiver data, that they're with the navigator would be in the 4 to 7 month range. And of course, you have to remember when you think about this, this isn't continual, right? It takes a long time because there's an initial intake, as Shelley mentioned, but then the navigator has to go away and they do research and they're looking for the right services, and then they get in touch with people again, or they're calling a pediatrician or getting in touch with a program in the area. And of course, there's all that calling and waiting and returning of calls. So we know that takes time, but it's about 4 to 7 month period. We have had people stay with us for upwards of 12 to 14 months. And we've had some people, as I mentioned earlier, where it's a 1 month kind of quick in and out. I can say that we see a variety of conditions. So really it's the full gamut. I think Shelley mentioned that. The typical condition we see though is autism spectrum disorder in a child anywhere between 4 and 8 to 10 years old, and typically male. That's what we're generally seeing. But we also have a number of children with rare genetic disorders, and a chunk who come to us where there isn't even a diagnosis. And those families would probably be some of our more complex. In terms of the reasons for calling, that's sort of the top ones are respite care, after school care, summer camps or camps throughout the year, and then basic service referral. Those would be the main reasons people call the center. Yeah, I'll get you to change slides, Shelley. Now, in terms of another piece of the evaluation, we've to date conducted a number of interviews with our caregivers. So once a case is archived, everybody who uses these services will get a satisfaction survey. And I can say to date that it's we had to revamp it last year. We've got about a 60% response rate across both caregivers and care providers. People typically are very satisfied. But what that then leads us into is we ask people if they would be amenable to an interview. And so to date, we've conducted 38 caregiver interviews where we look at a number of things. And we have actually published the findings from the caregiver interviews. That publication is around 23 of those interviews, but we continue to do these interviews because we see them as really important in terms of just continually improving what we're doing and to make it better. It's that whole living lab philosophy. From the caregiver interviews, there were sort of 3 basic areas that were covered in the interview, and we had feedback around what it's like to care for a child with complex care needs. I noticed something in the chat where somebody said a parent wants to be a parent. That came out really, really loud and clear in terms of the experiences of caring for children with complex care needs. And in fact, one of our themes was around, I want to be her parent, not her nurse. So that just really resonated with me when I saw that comment. The second piece was all around the challenges of navigating the system. And then the third piece, which I'm highlighting here on this slide, is all around the value of patient navigation. And essentially the themes that came out, we had 5. The first one speaks to this notion of she's got my back. And what we see here with she's got my back is that the navigator was very much seen as someone who provided a tremendous amount of support and ongoing encouragement. The second theme has made the entire process so much easier. This is fairly self-explanatory, but we heard again and again just how helpful and easy it was to go through this process. The third theme was around it's just like talking to an old friend. And what's being highlighted here is that the whole process is non-judgmental. It really, when we say it's family-centered, it's individualized, the parent or the caregiver, the person calling, they're in the driver's seat. It's about helping them to identify their goals and meeting those goals throughout the course of their time with the patient navigator. The fourth theme is provided the information that I needed. And of course, we've worked a lot on trying to build a really useful database of resources across the province so that we can continually improve and provide better care and provide the information that people need. And the last one is around quality of life. It drastically improved my quality of life. And this one, we heard this again and again, speaks to this notion that, you know, that these folks are experts, but they want a parent and they're tired, and it just takes one thing off their plate. It lifts a weight off their shoulders. It reduces some stress. And I remember in one of the interviews, a parent just saying, you know, I know what I need to do, but it was just nice to know that someone else was taking care of one of those items on my very long to-do list. Okay, if we can move to the next slide. So we've also done to date 10 care provider interviews. And some of the themes that came out of those interviews were around, we have 5 themes. The navigator was seen as a trusted source, which we think very much speaks to both the, just the getting out into the community and being seen as a service that's reliable. The connector piece as a second theme is really important in that it was really it's valuable that we're able to connect care providers to those resources and services that help them support their clients. Capacity builder, this is a really important thing that came out, and I was happy to see this as a theme, because something we want to do is build capacity across the province in terms of supporting members of the care team, care providers when they support and care for these families. It's a partnership, so that's the 4th theme that did come out, that it's very much a working with people. And I thought this was interesting because it's kind of similar to stuff we heard with the caregivers. The 5th theme is around time saver, that the patient navigator can really help relieve some of that pressure on care providers when they're trying to do so much for these families. All right, finally, lessons learned. Some of our big takeaways, I'd say the first one is around, and Shelley spoke quite a bit about this, our Patient and Family Advisory Council. In our Center for Research and Integrated Care, as well as NaviCare, we are very much committed to meaningful patient engagement, and having our advisory council has been a key component, I would say, to the ongoing success of NaviCare. So that's one of the things. And of course, Shelley mentioned the many activities they're engaged in, so I won't need to repeat that. Outreach and marketing, we've mentioned this before, it probably can't be said enough, but it's got to be an ongoing process. Especially if, like us, you're a center where you're not necessarily embedded in a clinic or a hospital, it's ongoing work to make sure that people know about the services you're providing. Something that's come up, and this is an interesting little lesson that we learned, is around the use of language. And we kind of know this, those of us who are researchers or probably clinicians fall into this trap, academics, is the language we use. And when we first started NaviCare, it was a patient navigation center for people with chronic conditions or chronic health conditions. And then we went into, well, we wanted to be broader and more inclusive, because we wanted to make sure that if you didn't have a diagnosis or your child didn't have a diagnosis, you'd still call. So we changed it to complex care needs. And after talking to some of our key stakeholders, we had people say, well, complex kind of makes me think that you're only thinking about that very narrow, medically complex. I think this came out earlier as well with the keynote. So we've recently changed it again to just, I think it's healthcare needs, to try and be as broad as possible. And the real message we're trying to put out there is that we're not going to turn anyone away. If somebody feels there's a healthcare need there, and complexity is very subjective, we will take them on. But that language piece has been an interesting learning. And finally, something we've had to deal with mostly from our care provider sector would be a fear that we're trying to duplicate services. And one of the things we've really tried to work with through our outreach and marketing is this notion that we are there to support. We will happily refer to other groups to do stuff if we think they're better suited. And it's not about stepping on toes or taking away from what other people are offering in our province. All right, I'll leave it there. Over to you, Shelley. You're muted.
So now we're just going to talk about how, so we talked about this center today, which is province-wide, focused on, as Allison said, children and youth with healthcare needs. I'm still transitioning to the language. I'm sure many times today I use the language complex, but so the idea too that we want to say here is that this type of program, patient navigation, can be used across a variety of settings with diverse populations and diverse conditions. So there's opportunities to spread a program like this. It can be condition specific, it can be broad like ours. The services can be easily adapted to different populations. It can be different methods of delivery. So ours is virtual. We've done a lot of work around patient navigation and looking at how different programs are implemented and the characteristics of different programs. They can be delivered in a face-to-face format, say in a hospital setting or in a community health center or a primary care clinic. They can be, I know there was some discussion online around, is this available 24/7? So they can be offered at different hours of the day. We talked a little bit too about the type of navigator. So we at one time had both a professional and a lay patient navigator. And we've actually done some research in this area as well. So on the last slide, we'll share one of the publications we have that actually compared the two. So looked at comparing patient navigators' perspectives around professional versus lay patient navigators. And so we've done some really interesting work in that area. And one of the things we found is that many times people, it's not so much the professional background, their experience, it's how the individual, how the navigator treats the client who is calling in. It's the way they make them feel and the support they provide. So that was something that was really interesting for us. You know, you could have somebody with all the credentials in the world, but if they don't have that rapport and that interpersonal communication skills and that vested interest in helping them navigate, it really doesn't matter what their professional background is. And so we've been doing the last 5 or 6 years, been doing a lot of work around patient navigation. We're right now spreading this, doing some work around implementing this with the MB New Brunswick Trauma Program. And I know this conference or workshop here is focused on children, but we also are doing some work now spreading this to help support people living with dementia, their caregivers, and the care team as well. So lots of opportunities. And I'm sure many of you on this call wear different hats as well and care for individuals across the lifespan, or if you're a caregiver, or I'm sure you have other experiences. So just to share that there's lots of opportunities here beyond the specifics that we talked about today. And if this is an area of interest for you, I just wanted to share too, before we wrap up, we are hosting a national conference. It's the first conference on patient navigation in Canada. It's going to be taking place in April, so just 3 weeks away, thereabouts. And so this conference, it was supposed to happen last year in April, but with COVID, it was postponed to this year. And it was supposed to happen in Toronto in person. But given the COVID pandemic, it's going to now be offered virtually next month. And registration is still open for those who are interested in attending and learning more about some of the really exciting work that's happening around patient navigation. We encourage you to check out this conference and consider registering. We even have some spaces for patient and family caregiver partners, so free registrations as well. So just get in touch with our team if that's of interest to you. And so the conference is going to be, so it's April 15th to 16th. We have great keynote speakers. So we have one, so Dr. Karen Frun, she's one of the leading patient navigation researchers in the US. And Ms. Kelly Anderson she's the founder of Family Smart. But what's really interesting about Kelly, so she has a son with significant mental health challenges, and she's been really instrumental in creating awareness and change regarding children's mental health in Canada. So she's our keynote as well. We have 2 keynotes at the conference because it runs over 2 days. So we have one each day. So just encourage you to check out this conference to learn more. There's a lot of presentations that are focused on children. They're especially around mental health, but there's a lot of diversity, but some really exciting presentations that might be of interest to you. So this slide here just has our contact information. This is our center's website. As I mentioned before too, we have the Facebook page, and we now also have, so we have a main Facebook page that's not the peer-to-peer support group, but then we separately have the peer-to-peer support group as an additional page. And then we have an email here, and this is all the contact information specifically for that our navigator would answer. Here's an example of, or here's a list of some of the publications that our team has published in this area. I will say, I know you probably can't copy it right now, but if you just go to our website around, if you go to NaviCare and there's a tab there that takes the publications, and most of them are publicly available and you can just click on them and read them at your leisure. But there's some interesting work. This top one actually now is in print. And so I think that's already on the website too. That's the one Allison mentioned with the caregiver findings. All right. And we just want to end off and thank our funders. So we've been fortunate to receive funding from various different organizations, but of most importance too, we want to thank all of our partners. So Allison are the ones presenting today, but there's an army working with us. And so we have our funders, we have our team members, our Patient Family Advisory Council who inform all that we do. We just wanted to recognize and thank their contributions as well. And thank you all for your attention to our presentation today. So we'll open it up now. I don't have access to the chat without making it come across the slide. So Allison, are you able to see if there's any questions?
I was monitoring it. I know there was, I mean, if people have a question right now, it'd be great to put it in the chat so I'm not scrolling all the way back. I do remember there was something around, can anyone join the Facebook page? And I can quickly say that Facebook group, which is based on peer-to-peer support, it is closed to families with complex care needs in New Brunswick. So the idea was to give folks in our province that level of support, but I think it would be a really interesting thing to scale up and easy to scale up. But one of the exciting things is it's done so well that it'll certainly have a life beyond its the PhD project that it started out as. So that's some good news. All right, so let's see. I have a question here. Do you have a formal peer support training program? We actually don't, and it's interesting around training. It's something we're always looking at. Shelley, did you have any thoughts on that?
No, we don't have anything specific to peer-to-peer support training. This venture into peer-to-peer support is new for us, and that's certainly something we could consider. I think I did see a comment just above very quickly when I was looking. There was a comment too around having parents help facilitate or the peer-to-peer support group sessions. So I did want to say that our Patient and Family Advisory Council, they are also moderators of the support group. So they are helping to facilitate the discussions. And we try to encourage them to take a lead role in helping to moderate discussions and help to facilitate the group. But they don't actually have, no one there actually has formal peer-to-peer support training. But it is an interesting idea though, to perhaps pursue having our Patient Family Advisory Council have that training. It's a good idea.
And I should just one more thing on the Facebook group. I can say, because we've been talking to our PhD student who's doing the findings, one of the interesting pieces around the role of the patient navigator who was there, it was sort of not necessarily in the original plans, and we thought it might help to generate some discussion. And what she's actually saying is she wasn't so much providing support as she was learning a tremendous amount about programs and resources she hadn't heard of yet in the province. So what's amazing about it is it's not just about building capacity for the parents, but it then fed back into our patient navigator and NaviCare in general. So I thought that was really great. Okay, so somebody's just mentioned, Shelley, that they've registered for the patient navigation program certificate from York University. Yes, I think we have one of our earlier navigators did that program, didn't they?
Yes, that's right.
Yeah.
I hear it's a great program.
Yeah.
That's great.
Is there a center for peer support in New Brunswick? Do you mean like what do you mean by a center for peer support? I'm not sure if, I don't think we would have something like that.
No.
I was saying that there is a center for peer support in, I think it's New Brunswick. So
Okay.
I'll drop the link in.
Oh yeah, that'd be wonderful.
Yep.
Thanks. Any other questions? I did try to watch when I wasn't talking.
Or any comments, if anyone else, maybe others have experience implementing patient navigation, any tips that they have or any thoughts that they want to share?
Sarah, I appreciated your comment where you said you use health complexity and have moved away from using medical complexity. I thought that was an interesting, I wrote that down when I saw that. So that's the language piece is always of interest. Is the navigator available 24 hours a day? Emergencies happen at night. Yes.
Yeah, I can address that maybe. So
Yeah,
the,
do that.
yeah, one thing we should really make clear is that the role of the navigator is not to provide emergency care. The navigator it's really for non-urgent situations, and we have disclaimers everywhere saying if there is an emergency, to direct them either. We have what's called 811. I'm not sure if every province in Canada has such a line, but it's an information line that if you're not sure where to go, there is that 811 where they can provide you with information on what to do in the urgent cases, and of course refer them on to the emergency room. But the type of support our navigator is not, she's not providing any care or treatment or medical advice. It's really more about navigating services and resources that are, again, non-urgent.
Yeah.
But it's a great point, especially around having maybe not 24 hours a day so much, but we would love to have more evening support, because we know that a lot of people work during the day and it's challenging for them to call in. But our navigator has been very flexible with her time. So if people can't meet with her during the daytime, I know that she does connect with them in the evenings. I know she's constantly checking her emails and getting back to people to help support them. So even though it is a Monday to Friday, we definitely have some flexibility as well to make sure that we're providing patient-centered and more flexible care.
Here's a question, Shelley. Someone asked earlier if we were able to share a logic model. So the answer to that is we can
Yeah,
share.
definitely.
Yeah.
Yep, and it's published as well, so we can share the publication. So if anybody wants to contact us directly, or as I said before too, if you go to our website, all of our publications are listed, and you should be able to just click the link and it should take you right to the publication.
All right, we have another question here. Counseling, directing patients to the right path that could avoid visits to the emergency department by more than 50% of the time. I mean, that is one of the things we'd like to think, that if we can actually really help people find appropriate services and resources and removing some of that stress, that would be one of the harder things, I would argue, that we have in terms of evaluation, is that sort of that level of impact. Shelley, did you want to say anything about that?
I would just say that I would want to make the distinction that patient navigators generally do not provide counseling. They provide more system and navigation and like support around accessing services and supports, but typically you wouldn't see them provide that one-on-one counseling. That might get more into a different type of provider role. There's lots of overlap with the role of a patient navigator with care coordinator and case manager and other types of roles, but the role of a patient navigator is typically not to provide that in-depth counseling. It's because that's more of an intervention, whereas I view the navigator's role as more trying to connect them to, say, a counselor or somebody who can help them direct them down the right path in that sense. It's more of a connector. Now, I'm conscious of the time. I realize we are at 4:45, and I think that is our time. Logan, do you want to